Provincially, the number of people in hospital or ICU with COVID-19 remains stable, with 51 people in the hospital, including 9 in intensive care. This is a slight increase from Friday, but well within our health system's capacity. It is good news that our hospitalization numbers have been generally declining or stable since peaking at 93 hospitalizations on July 22nd. Our public health and provincial lab teams continued working hard to identify new cases and process tests through the weekend. On Friday, September 18th, we identified 119 new cases, while the lab completed more than 12,400 tests. For Saturday, we identified 102 new cases and conducted about 9,700 new tests. And yesterday, we confirmed 137 new cases and completed more than 12,700 tests. Finally, I am happy to say that more than 15,000 Albertans have now recovered from the virus. We continue to closely monitor schools, and when new cases are identified, our health and education officials are working quickly to limit any possibility of spread. In 5 schools, alerts have ended, and all students and staff who were self-isolating at home have gone back to class with no in-school transmission resulting from the potential exposure. There are currently 81 schools with active alerts or outbreaks where 1 or more individuals have attended while infectious. So far, a total of 126 cases are linked to those schools. This includes 6 new school outbreaks that have been identified, bringing the total to 19 in the province. Alberta Health Services is working closely with these schools to investigate close contacts. I want to remind you that we define an outbreak as 2 or more confirmed cases in individuals who have been present at the school in the last 14 days. That is a very low number to reach and is not an indication of uncontrolled spread. I recognize that there is anxiety that comes with students returning to the classroom, and I am being as transparent as possible when I share information about cases. That is why I want to let you know that we have also identified another 2 schools where in-school transmission has likely occurred. This transmission was identified in cases at Vimy Ridge School in Edmonton and Springfield Elementary School in Peace River. As I stressed on Friday, this is not unexpected and is not a cause for alarm. As we have seen transmission in other settings, we will see some cases where this happens in classrooms. We are working with schools and Alberta Health Services to keep these numbers as small as possible and prevent broad spread within a school. Anyone potentially exposed has been or will be contacted and asked to self-isolate. Finally, I want to speak about the fact that we now have 2 schools on watch status. This is simply an indication that an outbreak has 5 or more cases. The Vimy Ridge School has crossed this level with 6 cases and will therefore be shown on the map as in watch. The only thing this reflects is the number of cases, not ongoing risk. While I know that the safety of schools is of utmost importance to all of us, it is important to remember that only 3% of all schools in the province have had any COVID-19 exposure to date. And of all those schools that have had 1 or more exposures, transmission has only been identified in about 3% of those. So overall, only just over 1 school in 1,000 has had a transmission episode in the last 3 weeks. We will continue to monitor closely, as always, but this is a positive start. While our school numbers remain encouraging, sadly I must report that 1 additional death occurred over the weekend. This death was in a patient at the Foothills Medical Centre in Calgary, and I would like to extend my condolences to this individual's family and loved ones. We take any outbreak in an acute care facility very seriously. To date, 14 patients and 4 staff members on 3 units have now tested positive for COVID-19. The public health investigation is still underway, but Alberta Health Services has taken swift action to ensure that all staff and patients who may have been exposed are isolated and getting tested. I've been assured that all necessary outbreak protocols have been implemented. With widespread testing underway, it is likely that we will identify some additional cases in the coming days. I know that any outbreak is concerning, especially in a care facility, but any patient with symptoms or who has tested positive for COVID-19 is isolated and treated in designated rooms. The Foothills Medical Centre remains a safe place to visit and to receive care. There is no increased risk to patients coming to the hospital. There has also been an outbreak identified at the men's residence of St. Joseph's College at the University of Alberta. There are currently 5 cases linked to this outbreak. AHS and the university's public health response team are working together to support contact tracing and to care for the health and isolation needs of those impacted. When a student has mild symptoms, so let's say a student who isn't part of an outbreak, they're not a close contact of someone with COVID-19, but they just have some mild symptoms, we want those kids to be able to get tested and get results as quickly as possible, so as soon as their symptoms resolve and they're feeling better, if they test negative, that they can go back to school. And that's work in progress across the system to try to reduce the turnaround times for our lab testing. And there is a lot of work going into that to make that happen. It is unfortunately a very complex system, so it's not something that can change overnight, but we recognize that getting test results as quickly as possible and getting tested as quickly as possible, both of those are really important, and there is a lot of work going into making that happen. The second piece is if a child is identified as a close contact, whether at school or out of school, often they will be asked to have a test taken, have a swab done. Independent of the results of that test, though, they do still need to stay home for 14 days. And I think that has been something we've heard concerns about from parents who are worried about the fact that even though their child tested negative, why do they have to stay home for 14 days? And the answer to that is if a child is a close contact of someone with COVID-19, they themselves could get COVID, and it could take up to 14 days for them to get sick. And if they test negative at any point in that 14 days, it doesn't guarantee that they will remain negative for the entire 2 weeks. So while it is a very long time, unfortunately, in those cases, they do need to stay home for that full 2-week period. What we are doing, however, right now we're taking a very cautious approach. So when there is a single infectious case in a classroom, that entire class is asked to stay home for that 14-day period. And we're watching very closely our experiences with those class cohorts to understand how we can be more targeted so we don't have to have the whole class stay home in future once we have our own data to be able to understand how to pinpoint those close contacts who are most at risk. We will be able to focus just on those and not have the entire class stay home. But for right now, and I do know this has an impact on parents, we are having that whole class stay home for that full 14-day period and working on being able to target that going forward when we have enough data.